to a radiologist. So I went right to the radiologist, Forest Hills, Queens. Went to the radiologist. She was even kind of rolling her eyes. She was like, all right, we'll check. And then her eyes got so big as she was doing it.
Like the balls on you.
Dog. She was literally doing it. She was like, all right. And then she was like, you're 98%.
She did the, my God.
No, it was, dude. It was weird.
Today, we talk about.
Correct.
All right, so we're back.
Yours is really quiet.
I don't think so.
In the headphones, it is.
How about, no?
That's better.
All right, so where were we? Episode something 50 something. Back with some cuck. And let's keep it moving, shall we? No, we do have Zachariah Eugene Bunzing back in the building. Yeah. And then
shit.
Then we'll do so today we'll be covering blood clots, aka DVTs, PEs, combinations, day. We'll also be covering the history of the Nike Air Tech Challenge 2s, followed by a sneaker release segment, which we'll figure out on the fly. Then we'll wrap up with a Lakers/sports segment and finish it off with a live Q&A. So let's get started with this DVT thing.
I was here to play video games.
I know. But on your way to playing video games, you got a DVT once.
Yeah.
Last year, actually.
Yep. Almost about a year ago.
And then when you got it, you had that classic situation of getting on an airplane, not getting up in between a long-ass cross-country flight, and then you get this clot developing in your leg. That's nutty. Oh, and then it traveled to your lungs,
both of them.
Nice. So when you have what's called a deep venous thrombosis, DVT for short, that's just a fancy way of saying you have a blood clot, typically in your extremities. So more commonly in the legs, but it can happen in your arms too. And what will happen is the clot will bust off, and a piece of it can travel up into the lungs, which is what happened to you, because you're a bun. All right. So what the situation here is the reason this situation is a little weird is because of your age and lack of other like risk factors for it. Other than the fact that, the classic story is you get on a flight or you're on a road trip, you don't get up for like dumb hours. And then the way it works is you don't have any like blood pumps in your legs. So like your heart is pumping blood out, forward and down with gravity, but then what's helping the leg blood get back up? It's your actual calves and your leg muscles. So anytime you walk, the leg muscle squeeze, and then your blood will actually get shot back into the heart, and then the cycle repeats. So in your case, if you're sitting down on a plane and you don't move for dumb hours, then that blood is going to collect there, sit there, stagnate, and potentially clot. And that's probably what happened to you. Actually, that's definitely what happened to you.
Yeah, but they were freaking out because, and if I could tell a quick rundown of the story. So it's actually kind of crazy. I went to a flight. I went to LA for work. Didn't get up. Returned home.
They can see your tab, Bunzing.
Bicep. Didn't get up on the ride home either. And then when I got home, I had this like really and I think this is important because I do not think people know about this, like disease, not disease. What
I did not sleep with that woman. What?
No, condition. What would you call it? Not because it's not a disease. It's like a
what? The clot?
Yeah, a clot.
Yeah, it's a condition.
It's condition. Yeah. So what I think, because actually what kind of saved my life is, so after I got back from LA, after flying, I had this really, really bad pain in my leg. Like I could barely walk.
Damn, son. Where'd you find this?
It felt like it was so deep. I was like, oh, I must have heard at the gym or playing basketball or something.
We talking balls deep?
Yeah, it was bad. But it hurt so bad, and I was just kind of like, oh, I didn't even put two and two together. And then I had another business trip to Montreal.
Another flight?
Yeah.
Sure. Yeah, but that flight isn't as long though. So
no, I know, but on the way to Montreal from the city, there was no in-flight entertainment, so they only had like a pamphlet, and I was just like flipping through the pamphlet. And right before I actually went to Montreal, I was at urgent care, and they were like, "Oh, it sounds like you have pneumonia." So they gave me 5 days of antibiotics.
Right.
So I was on antibiotics because I could hardly breathe. I could hardly walk like 2 city blocks without like puking.
And then even when you went to the hospital,
no, because you had urgent care.
Yeah, I know, but wasn't it after? Or?
No. So this is like when I first started seeing the symptoms, like being hardly able to breathe, coughing all the time.
Yeah.
I went to urgent care. They're like, all right, it's probably pneumonia. Gave me antibiotics.
Yeah.
Didn't help at all. And then on the flight to Montreal, I landed in Montreal after reading that pamphlet. Yeah, and they're in the back of the pamphlet. It just mentions like symptoms of DVT. It's like, like deep pain in your leg,
Yep.
And then it's like also it could become PE, which stands for pulmonary
embolism.
Yeah. And it's like if you have these symptoms, and it basically sounds like a pneumonia. It was like if you have these symptoms, go to the emergency room immediately because that means the clot broke off and went to your lungs.
Yeah.
So I'm in Canada and I'm reading this, and
then you're like, free healthcare triggered.
I know. I was like, I can't even get free healthcare here because I was looking.
Wait, you couldn't? Oh, because you're not
because I'm not a citizen. Yeah. So I was looking it up because I was literally.
But can't you go to the ER and they just can't refuse care for you? I know that's a rule in the U.S., but
yeah, but you still have to pay.
No, I don't. Well,
you'll get a bill. They can't refuse care.
Right.
It's not like you're checking out.
Right. But you can't. Yeah, how would they track you back to the U.S.?
Yeah, I wonder how.
Well, I don't know.
They're like Zach Benzic.
Yeah. Seen him on Dr. Soul's channel? Kids are right.
I mean, but and I'm not like a, what is it, hypochondriac?
Hypochondriac, yeah.
Yeah, when you're scared, like all that kind of crap.
Yeah.
Like I'm not like one of those guys that read WebMD.
Oh, trust me, I know. You went months with hepatitis A and just never even got it dealt with. Yeah. So I know your threshold is high for...
yeah, so I was like, it is what it is. Walking around. But I was in Montreal, and I was on a business trip. So I was like, whatever, I'll just, tough it out. I actually had a transfer in Charlotte, North Carolina, and then back to New York. I went to New York after the business trip and went right to urgent care. And I was like, I think I had this DVT thing. And they were like, there's no way. You're young. Your leg looks fine.
Yeah, you're not the prime suspect.
Yeah, they were like, okay, well, I guess we can't rule it out. So here's like a referral to a radiologist. So I went right to the radiologist, Forest Hills, Queens. Went to the radiologist. She was even kind of rolling her eyes. She was like, all right, we'll check. And then her eyes got so big as she was doing it.
Like the balls on you.
Dog. She was literally doing it. She was like, all right. And then she was like, you're 98%.
She did the, my God.
No, it was, dude, it was weird. I've never been like in that kind of situation where like, as she's doing it, she just kind of like she was literally like, huh.
Probably more because she was embarrassed. She was just like, there's no way.
Oh, I know. Yeah.
It's not because she was like astonished that there was such a thing.
No, she actually when I went back.
Like, oh God, I got to apologize to this cuck.
6 months after the thing, she came back. She's like, oh, I remember you. I was 98% clotted.
I mean, yeah, it's hard to forget a young person
clotted.
that gets sick.
But and then she's
you have to realize how easy it is to point out a patient that doesn't have gray hair. Do you understand like how few of those I see?
Yeah.
So
no, I know. No, but she was just
let alone someone that comes in with something crazy like that. We're just
from urgent care too. Yeah. So from urgent care, they're probably like, all right, these guys are hacks.
Well, no, urgent care refers like almost everything.
That's what I mean. Yeah. So she's like, oh, urgent care.
Oh, okay.
She's like, I don't give a fuck. It probably doesn't matter. But so after urgent care, after doing the radiologist, she scanned it, 98% clotted. She was like, all right, you have to go to the emergency room right now. Go to the emergency room. It was annoying because as soon as I got in, I called my wife. She came in. We went and they did like a CAT scan or something. Is that what they do? On my lungs. Because they put like metallic shit in my
CTA. Veins. It's a CT angiography, a.k.a. CAT scan with a special dye. They shoot through your veins. Yeah. And then the way it
tastes like the worst vodka in the world.
Right.
It literally did.
Wait, they made you taste it?
No, but like you felt it in the back of your
interesting. Yeah. I didn't know that.
You tasted it in the back of your throat.
Huh. Weird. I didn't know that. But yeah, it basically gets infused into you and then it floods throughout your whole body. And where it's supposed to go is when it gets to the lungs in the area where the blood exchange is supposed to happen with the air exchange, you see some defects there that are like, why isn't this part filling? And that's usually where the clot is. So that's how they found it.
Yeah, it was funny. He was a black dude. He was like, he was super cool. The guy that injected me, he was like, it's going to taste like really nasty. And I was like, it tastes like the worst vodka of my life. He was like,
Wait, that's what he said?
He
That's
said
what
it
you
tastes
said
nasty, and I said it
after
tastes like the worst vodka in your
Wow,
life. And then he was like, your name's Zachariah? I was like, yeah. He's like, last book of the Old Testament. I was like, it's actually Zechariah, but it is different. People have said that to me before. My name is Zachariah, but the last book of the Old Testament is Zechariah. But
Cool.
I'm just saying. I corrected him.
Well, anyway.
I don't know why.
Anyway,
But,
so you get this diagnosis.
So yeah, it's annoying because I get the diagnosis. They bring me in, and they start freaking out. All these people at the ER, and they put 2 blood thinners in both my or a blood thinner in each of my arm.
They put an IV.
Yeah, in each of my arms.
Yeah.
And the doctor's a fucking. I still do not like.
Nice guy.
No, he's a prick.
Yeah.
He's an Asian guy.
Mr. Nice.
He
Dr.
was
Nice
excited.
Guy.
My
Yeah.
wife's in there with me, and he comes in and he's like, I'm not sure why someone your age would have this. It's probably cancer. We're going to run some tests, though. So I was like, why do you lead off?
Well, that's because I'm picturing this cuck, and this cuck is probably one of those book smart cucks that don't have any street smarts, got into medical school because they could
don't say
circle
fucking
A, B,
cancer in
C,
front of a
D.
wife.
They don't really have any very well maintained, let alone like flourishing relationship with human beings. So like they don't really even know that what's right and what's wrong to say. And then
he seemed like a narcissist. He was super fit. Like he had huge arms.
yeah, so maybe he takes it out there because he can't connect with people elsewhere. I'm just deep diving here. But my point is that's definitely a factor. But I think he just
Why say cancer?
can't be a stand-up comedian because he can't read the room. Am I right? Hey.
Helpful.
Yeah,
But
well, this is why he said cancer, because these are the risk factors. I'm going to read these off. These are straight off of the Wikipedia, so you know it's legit.
Yeah, but why say that in front of people before
Because,
even doing a
like
test?
I said, I don't think he had the emotional intelligence to like even know to
Yeah,
not
sure.
do
I mean,
that.
it could have been cancer. Yeah,
But
obviously.
honestly, that's because here I'm going to read you the list. You tell me which of these you're just at face value at highest risk.
But
for.
I'm not going to
Pregnancy.
say any.
No.
Yeah.
Trauma. Did
Maybe.
you get wheeled in on an ambulance? No.
Could've been scared.
Did you have recent surgery?
No.
No. Did you have obesity? Not yet. Hup, up, 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 up. And then what else? Are you a smoker?
Not really.
Okay. And then what's the other one? Are you on hormonal birth control?
Yes.
Ooh. Plot twist. All right. And then exposed. Do you have antiphospholipid syndrome? Ain't
nobody got time for that.
Sure. So, and certain genetic conditions. Do you have any genetic conditions that you know of?
No.
So, what does that leave
But
us,
why-
Johnny? What's the
why-
last
why-
one on
why-
the list? Cancer.
Why say that before you do the test? Because then they did the test and he was like, no cancer.
I'm on your team and his team. I'm on his team because he went with the most likely thing, which of these things on the list, let's go. But I'm also on your team in that he should just keep that to himself.
Yeah, keep it to yourself.
And
run the
not say that
test.
shit. So for the
Especially in front of the wife, too.
For the diagnosticians listening in, know your limits. Don't be a douchebag. That's half the battle of this medicine thing. Trust me. No one's going to ask you what your score was on the MCATs or step 1 through 3 anyway. So,
and then after that,
so yeah, they did the testing. It's not cancer.
They did the test, not cancer, but
It's not a genetic condition, such as factor V Leiden, the most
were
common
asking what was
one,
going on.
protein
I was
S,
like, oh,
antithrombin protein C. Lupus sometimes can do it too. All these things, you've been ruled out.
Yeah.
Yeah.
They were just like, oh, like, have you gone anywhere? I was like, I went on a flight. My leg really hurt. It was kind of nice for my ego because they were like, how did you walk around? Because they were like, they literally said, they were like, it's in both lungs and it's a couple days away from getting to your heart. They're like, how were you walking around with that? I was like, every day is a struggle.
Yeah,
dog.
if that clot,
but it hurt so bad.
Yeah, if
but
that-
I kept working.
if that clot hits the sweet spot though, you could instantly die. Like you could literally instantly die.
Yeah. That's why they put me. Yeah, I was in. So after that, they were like, it's in both lungs. It is crazy. It is funny.
Because that's
It's
literally
funny
what
because
you
they were
need
like,
to breathe.
so. Was there like you didn't have any pain? I was like, dog, every day is pain. I was like,
Yeah, no,
live my life.
It sounds miserable, but
No, but and then they put me into. Do you want me to keep going about the medical experience or about being in there with
being there with the old
foreigners?
guys and shit? Nah,
It's kind of funny.
no, I know, but we could do that in a different segment. Let's do. Let's skip ahead to your treatment. So they had to treat you, right? So typically how this works is they'll put you on an IV infusion of a blood thinning drug called heparin, and then they'll transition you into something long term, something like a warfarin Coumadin pill, which is old school as fuck, versus the new age anticoagulants, aka new age blood thinners. So these are the things like what you ended up on, like Xarelto. There's Pradaxa. There's Jesus Christ. There's like 11,000 of them. So there's a lot. There's always new ones coming out in the market. But definitely as far as like monitoring and stuff, we don't have to get into too many details here, but that's the mainstay of therapy is you got to thin out the blood. And we'll get into why or how your experience was on the Xarelto. But before I do that, I just want to say the key here is the blood thinner is not to bust the clot open. So the clot you got. Your body's going to naturally break that clot down. The key is you end up on these blood thinning medications so that while your body's doing it, you're not adding on extra clot burden from whatever's left in his leg or in the lung, breaking off and causing another piece in the wrong place at the wrong time. So that's kind of the key hallmark to these blood thinners is like you're trying to keep the blood thin so that additional clotting doesn't happen, because it's kind of like a vicious cycle. Once the clotting starts, it just fucking starts building on itself because of all the different fucking enzyme factors and bullshit and data that gets activated. So you're trying to limit that. Now, with that said, tell me about Xarelto, because I imagine they weren't going to put you on warfarin, but warfarin/Coumadin, from what I hear, it's a piece of the puzzle to rat poison, interestingly.
Yeah.
But the way it works is it stops your liver from making certain clotting factors that you need to clot. The problem with it is it can be affected by foods that you eat. So like grapefruits, if you were to eat a fuck ton of grapefruits, it would literally fuck with the levels of warfarin in your body, let alone a bunch of other medications. Because typically, not you, but people in your position typically have like 8,000 other medical conditions going on. They're taking a fuck ton of medications. And so some of the things can interact. So they have to go in for routine blood testing to check the blood thinning level of warfarin.
Yeah.
It's something called an INR, International Neutralized Ratio or something like that. But bottom line is it's this number that has to be in a sweet spot of 2 to 3. So typically at normal, without blood thinners, you're sitting at about a 1. With the blood thinners, you're trying to get to a range of 2.5, but basically 2 to 3 is like that sweet spot. So that's what you're looking for. And it's kind of a bitch and a pain in the ass to constantly be monitoring your numbers so that you know what dose to be on. So one day you may be on 5 milligrams, the next day you may be on 2.5, the next day you may be on 7.5. And it's kind of a bitch. Now you got lucky because you got your ish in the post new age blood thinning medication era. So you got Xarelto, and you were taking it what, just once a day?
For the first 4 months, twice a day.
4 months, twice a day. And you were taking it for a total of 6 months at first, right?
No, I just stopped last month.
And that was almost a year, right?
Yeah.
Okay. So...
But for the first 4 months, twice a day, and then once a day.
So you were on once a day for how long?
Long time. Because remember when I went... so 4 months ago, I went back...
Well, yeah, I guess because you've been on it for a fucking year now, or
yeah.
basically.
So I went back to the radiologist. This is kind of skipping ahead, but I went back to the radiologist, and they were like, "This is like 4 months ago," and they were like, "Well, it still looks a little clotted," but they weren't sure if it was scar tissue or actual clotting. So they were like, "Just stay on it for another 4 months, and we'll retest." And then a few weeks ago, I went back, and they were like, "Oh, it's the exact same." So I guess it's just scar tissue. So now I'm off it. But I've only been off for a couple of weeks.
Gotcha. Yeah,
but they just weren't sure. You know what I mean?
Right. Yeah, I mean, you're never going to be 100% certain.
I can feel it, though.
Well, you'll definitely feel something.
No. I mean,
whether it's scar or...
No, you could feel it in my vein.
Right.
Versus both legs. You can still feel this one popping out. And they say I could do surgery, but I just don't want someone doing surgery on an artery.
Yeah, I don't think the surgery is going to be very helpful, but that's just
exactly.
me.
Well, it's scar tissue. Well, it's like, what are you going to do, scrape it?
Yeah. I mean, but that will put you at risk for more scar tissue. It's like a whole thing.
That's what I mean. Yeah, like I'm like leaving it alone.
But surgery does come into play for certain things. Maybe not technically surgery, but thrombectomy or thrombolysis. So this would be in the setting of like if the clot is like super life-threatening. We're talking like acute. You show up in the hospital, you're near death. Yeah, for they would do like a clot buster, basically.
That's like it's pretty low success, right?
It's not that it's low success, but it's you have a window. You have a window to use it, And you got to be careful because you could clot bust to an extent that you could cause a spontaneous bleed,
So
like in your
after-
brain, which
after-
would be bad.
Yeah, after the radiologist, when I first had it last year, because I just took an Uber to the hospital. Because they're like, you need to go to the hospital. I was like, I'm not calling 911. I'll just take an Uber. I was reading about it, and I read about that. They were like, oh, if it's this serious, you need this surgery. But then I read about it. There's like a 50% survival rate.
Yeah, it's
I was like, my fucking God.
Well, you have to remember too, for survival rate, you have to remember the kinds of people getting these treatments are like so close to gone. Like this is just like it's life or death.
An old person didn't realize it. Yeah.
So the success rate
it wasn't helpful, put it that way, and also it wasn't helpful to read about like man, I was so close to dying. It is kind of crazy.
Yep.
You know shit.
Yeah. I mean, it was nuts, and it's
pretty bad.
Only because I read about it myself. If I didn't, I would have thought I had pneumonia.
Yeah, you probably would have brushed it off. I mean, there's no. Who's to say you couldn't have just broken down the clot on your own over time with no blood thinners? But the risk would be super high.
Both lungs and PE.
Yeah. No, I mean it can happen. I'm just saying, like you definitely. It's not a risk you're willing to take.
Yeah, but couldn't my body? Because my understanding is PE, if it's in your lungs, like you're fucked.
No, you're not fucked because you clearly had it. You made it.
No. But like it's a ticking time. Like it's
it's not a ticking time bomb. It's think about it in terms of like pieces. So like if you get a large enough blood clot in your leg, if the whole thing breaks off, it's going to break off into just like a little bit further up your leg, and that's it. If the clot breaks off just like a little bit, that little bit will go all the way to your fucking lungs.
Well, that's what I had.
But it'll be such
lungs.
a tiny right. But it'll be such a tiny bit. It may not cause jack shit. Okay, so that's the next level. Then you have this whole spectrum all the way to like, it's big enough where it'll lodge in your lungs and cause you breathing problems, but it's not small enough where it'll fit through the exact place it needs to go to obstruct both parts of your lungs or both blood supplies of your lungs and cause your heart to basically just stop beating instantaneously.
But mine kind of was, since it was in both. And they acted like it was a crazy
You can get it in both, but that's what I'm saying.
I had it in both.
Right, you can get it in both, but I'm saying that doesn't dictate how severe it is because it depends on a lot of factors, size, how many.
I could have lived without going to the hospital.
You could have lived, but I mean, the risk wouldn't be worth like playing it.
Yeah,
playing the odds.
Yeah, I'm like,
don't play the odds. Yeah, don't do that. But speaking of prognosis, so prognosis is like, how long do I have to live, doc? What's my prognosis? That's what prognosis is. The most frequent complication is post-thrombotic syndrome. I think that may be what you have, but I'm not sure. I'll double check on that. The other thing is estimated 20 to 50% of those with DVT will develop that, if that is what you have. Let's see. Untreated lower extremity DVT. So if you didn't go to the hospital, untreated had a 3% PE-related mortality rate. So you had a 3% risk of death from a piece of the leg coming off, causing a clot, and you dying. And you had to go to your lungs, and you didn't die. So you're part of the 97%. You didn't die. You're still with us. Yeah.
They actually was way more serious than that.
It's serious. You don't want to be in the 3%. 3% is not chump change.
Okay, but DVT is different than PE.
I have seen hundreds of people with DVTs. So
yeah, but now we're talking PE because DVT is a precursor. It's like HIV/AIDS.
Kind of, not really.
Well, no, but I'm saying like HIV is the precursor.
Sure.
To the getting AIDS. The mortality rate what's the mortality rate for PE?
Well, that's what they're saying.
No.
You can't die from a DVT. That's the bottom line.
Yeah, 100%.
Because you have a clot in your leg, you're not going to die from that.
Exactly.
You die when it breaks off and becomes a PE. So they're part of the same entity.
In both lungs.
So a DVT associated PE, which is how they quote this, which is the only way you would die, is 3%. So you had a 3% risk of death with that clot.
Nothing.
It's not nothing.
No, but what's the percentage of death? Could you pull up?
Jamie?
Kenny? Could you pull up the percentage of deaths with PE? Especially in both lungs. They freak the hell out.
That's what I'm trying to tell you is you don't just suddenly get a PE.
But now we're not talking. I'm saying DVT, that's one thing. PE's another thing.
And what I'm trying to tell you is you can't get a PE without a DVT.
I know, but what is the percentage of death?
I just said 3% because you can
of
only
DVT. So you're saying, but that's
because you can't
different.
get a PE without
but
DVT.
But the 3% is like 3% of people have DVTs. How many people?
No. A bunch of people had DVTs. How many of them died? Only the ones where the DVT became a PE.
And I'm saying,
how many of those happened to? 3%.
How many people with a PE died?
3%.
No, that's DVT that became a PE.
Oh, I see. So you're asking what percent of patients
People
with
that the
DVTs
DVT
get a
actually
PE?
became a PE who died.
Well, that's 3%.
Yeah, but of that 3%.
So how many
mine
people got a
actually
PE?
became a PE.
Yeah. So how many
Yeah.
people got a PE and didn't die? What is the risk of PE from DVT?
No. Just look at PE death rates.
I just did do 3%. I don't know.
No, but that's 3% of people that
Get
have a
a-
DVT. Because I'm in that 3%.
Right.
I'm in that 3% in general.
Right.
Because my DVT became a PE.
And what I'm trying to tell you is no one gets a PE without a DVT.
I know.
So it's a
but
redundant
also
question.
how many not that many DVTs even become a PE.
Yeah. So the death rate from that is
Okay.
0% because you can't die
Yeah,
from
you
a
can't die
clot
from
in
a
your
DVT.
leg.
Yeah, but even that 3%, how many of those are conversion rates between a DVT and a PE? Because you could have.
Yeah, you're asking how many patients go from a DVT to a PE. Period.
Yeah.
That's what I'm looking for.
Yeah. You need a cat in here, by the way. It would be so happy. There's so much stuff to jump on.
That's not my style.
Dude, a cat would be so amazing for you.
I don't think so.
I'll bring Kenny over.
Nah,
I'll ask her.
I'm good. Yuck. So the risk of nope. So pregnancy increases your risk of
Okay,
DVTs,
what are we even
PEs
talking
by
about?
5 times. By the
Well,
way,
I'm not pregnant, so
I understand, but just for the folks at home, because I'm trying to not just entertain you, but entertain a lot of people here. All 11 dozens of them. There's dozens of us. Okay, so this is clearly not helpful for that. Let's look at DVT PE conversion rate.
Just look at mortality of PE.
Let's see outcomes. So the effect of blah blah blah. Ugh, that's not helpful either.
Just look at mortality of PE, because once it transitions to PE, it's a completely different disease
How many DVT
or condition.
Boom. Nearly 40% of patients with a DVT will develop a PE. So there
Okay.
you go.
And what's the mortality rate of PE?
3%.
No, 3% is the amount of people that die from a PE from a DVT.
Right. And I'm telling you, you can't get a PE without a DVT.
So what's the 40%? So 40% of people.
40% of people like yourself, you're of the 40% that got it from the DVT.
Then what was the 3%?
Some people just get
What's the 3%?
The 3% is you're part of the 37% that didn't die.
Okay, so now we're just minusing percent. Okay, this is
Yeah, I don't understand. Listen, leave the math to
been a
me,
long-
buddy. Trust me.
I don't have a log.
Leave the math to me.
Calculator.
My iPhone has all the functions. All right. Anyway, so that's so yeah. You took the Xarelto. I want to just read off the other.
Xarelto is a great drug, by the way. Like it definitely.
Yeah, that's the nice thing with Xarelto. You didn't have to go in for routine monitoring. It was
nothing.
just the same dose every day
But the worst
for
thing,
as long as you were on it.
the worst thing is you bruise. Like if you hit if you run to a sofa, a door hits you. Shaving sucks. You bleed out.
Oh yeah, that's right.
Like the blood thinner, I didn't think it was that serious. Like as pronounced as it would be. I'd be like shaving and kind of nip myself.
Yeah.
And I never bruise.
Even people that are just taking aspirin every day, they'll bleed a lot easier. It's just what it is, you know? Because that's what it is. When you nick yourself, or if you run into something, you have micro level blood vessels that you bruised and nicked, and now they're bleeding, and you don't see it on the outside, but like they're bleeding. And then if your blood thinners, your blood clotting factors all start to fucking do their thing. And you're trying to get them to not do that by taking these medications. So when you do that, then they're not going to fucking do their job, and then you just start seeing these like major bruises all over from like knocks into furniture you don't even remember because like that's how insignificant.
Which I never. That was just the most pronounced thing because I never used to like really like my blood was always pretty good where it would clot up really quick. I never bruised. Playing physical sports, never bruised.
That's probably another factor why you got the DVT because you were so quick at clotting, the shit got on itself, you know. But yeah, let me just read some more factoids here. Let's see. I don't want to get too medical on y'all.
So you don't want to hear about my hospital experience?
Oh, I've heard it too many times.
Yeah, but nobody else has.
If anyone else wants to hear it,
foreigners.
let us know. We'll have them back to give
foreigners.
us the full story.
Nobody spoke English.
Let's see. Summary. Oh,
I
information for
had to
patients.
watch a guy die of cirrhosis.
I saw him die.
Dude, he was dying.
I know.
Immigrant.
So let's see.
I watched that for 4 days. That was fun. That was exactly how you want to live.
Great. This
Turn up Telemundo to
so this
level 80
article
every day.
this article has everything you need to know for a patient level of understanding instead of like the doctor level of understanding, but it's just too long. It doesn't give me a summary, so I don't want to like read through this whole thing.
Live?
Of course we're live, or we're not live, but it is what it is.
Wait, I mean, I know we're live.
So yeah,
Wait, are you broadcasting this or anything?
it's not. I don't understand what you're asking me.
Or are
We're
you, like, on
recording.
Instagram? Okay, so we're not live.
We're not live.
That's what I meant.
Yeah, no, we're not live.
No, I meant are we live?
But what's it mean to be alive?
I don't know what you're asking.
Jesus. All right. I mean, that's all I wanted to discuss, really. Just to keep it simple, if you're having breathing, if you're having, I told you, if you're having breathing problems and you just got up from a long road trip or a long plane ride and you didn't get up, please get up during the flight. First of all, every few hours or so, in between episodes of a TV show or a movie or something. Obviously, it helps if you're in an aisle seat. If you're sitting in the window seat, then I guess aisle seat triggered. You're just gonna have to like get up a few times, or at least just stretch out your legs a little bit. Just like play around with them in the seat. Make sure your calves get a little raising done and shit.
But if you have a bad pain, that's the...
That can be a clue. Not everyone has bad pains. Another clue can be, I mean, you see your legs all day, every day. So what you want to do is compare your leg sizes and see if one doesn't look a little bit more swollen than the other, one doesn't look a little bit more red than the other. These would be other signs. The breathing stuff you may not get because if it doesn't travel up to your lung yet, that's a good thing, but it may be too undetectable for you to catch if it's just in your legs. But if you have like a pain in your leg like you kind of did, then...
Yeah, my personal experience, and yeah, I mean, I agree with everything you're saying, but my personal experience was my legs looked exactly the same. It felt like a deep muscle pain.
Yeah. Which, that's the other thing. You want to be careful. It's not just a sore muscle. You want to pay attention, especially if it's one side over the other. You can get it in both legs, but typically you get it in just one. The other factor I would say is just know the kind of testing to expect. So like they're not going to find this with an x-ray of your leg. That's not going to find the clot. You got to get an ultrasound. So the ultrasound will look at the vein, make sure that the vein squeezes down when they push on it with the probe. If that doesn't happen, or if they see something abnormal in that regard, then they're like, oh shit, son, there's a clot here. And then to test for the PE, the pulmonary embolism, the lung clot, where it breaks off from the leg in the DVT form and becomes the lung clot in the PE form. For that, there can be one like kind of poor man's test called a VQ scan. It's like a perfusion scan. If you have issues with dye, if you have an allergy to dye, IV contrast dye, all that kind of ish. But the ideal test to do is a CAT scan, angiography, CTA, and that way they can actually look for the clot and then get it going. So then you need treatment, which depending on how you got the clot, based on those risk factors we mentioned earlier, or some other factors that your doctor will talk to you about in person. Again, disclaimer, this is just edutainment. This is not fucking medical hour / suing hour. None of that shit.
Ain't nobody got time for that.
Yeah.
Another thing I just want to add too, because I talk to my radiologist a lot because I've had to be there multiple times. Even if you're not traveling, if you're an office job person, they've seen a lot of DVT people from just like sitting there. If you're sitting there, you're a programmer or something like that. You're sitting in your chair.
If you're sitting your fat ass watching 11 hours of YouTube, if you're watching 11 hours of Dr. Souls a day, get help. It's not good for you, and you could get a DVT from it. You got to move around.
And it's very scary.
Yeah.
So just...
And it can kill you, so let's be clear. With that said, we talked about treatment. We talked about diagnosis. We talked about risk factors. We talked about... I didn't finish with treatment. So treatment options is really going to depend on how you got it and how long you're going to be on the medication. Also is going to depend on how you got it, whether it was from surgery, from pregnancy. Do not, ladies, do not smoke and be on birth control pills at the same time past the age of 35. Fuck it. Don't even risk getting close to 35 is my opinion. So, and honestly, don't be smoking anyway. It's not good for you. You know, it's not cool anymore. At least from the people I've met, they don't really find it cool. They find it kind of embarrassing. But if you're a smoker, you're a smoker. It is what it is. But I'm just saying, definitely don't do that. Plus, be on birth control pills because that will increase your risk for clots, amongst other ish. With that said, let's wrap this up. Thanks to our DVT cut guest.
1 second, too. One thing that does really suck, if you're on Xarelto, you can't work out. You can't play physical activities. It really sucks. I used to be like pretty physically active. I'm starting to get back into it, but
Speaking of which, that's what took out Chris Bosch's career.
I know.
The blood clots.
Because you can't, because the big factor is you don't know if you hurt yourself internally because they don't clot, so you could bleed out internally.
Yeah,
so you really have to like stop doing like most stuff except for like yoga. I
see the brunt of patients on blood thinners too, because like when your blood's thinner, you're at higher risk for GI bleeds, and then I deal with a lot of that ish. So it's just part of what it is.
It sucks.
But yeah, thanks for sharing your journey with us. Cool. With that said, this has been Medicine Made Easy with Dr. Azizi. See you on the next segment. Boom, bitch. So I just repositioned the kicks for the tertiary camera. Hopefully you guys can see that. But I figured, why don't we talk about this? I meant to be talking about this last time. I just didn't get around to it. This is the Nike AirTech Challenge 2. I've worn this shoe many times. I've talked about it many times. But yeah, I haven't really gone into the deep history of the sneaker, so I figured why not? All right, so it came out in 1989. This being the OG colorway, the debut colorway, the hot lavas, and yeah, this was a key time for Andre Agassi, because back then he was kind of like the bad boy of tennis, and so let's just kind of get into this here. Perhaps the biggest worldwide star in tennis history. That's how the BBC described him back in the day. This was back in his retirement around 2006, baby. This guy played till 2006. Let's see. Andre's impact. Day. I just can't believe this is a fucking performance tennis shoe, bro. Like, I feel like no one wears sneakers with this kind of flash. Like, this shit pops, bro. This shit's got a lot more bop than almost any other sneaker in my collection. Let's be honest, all right? But let's see. So, it refined... I'm already going, baby. Refined a technical approach, introduced the Air Trainer 1s. I had briefly shown those before. And those, great. Clever. Oh. We keep moving here. So the Air Trainer 1s, I showed you guys the green trainers that Bo Jackson and McEnroe both kind of flagshipped, and then I believe Andre Agassi also had worn it at the time. Then we moved on into, let's see, 89 when this came out. So let me see where I can find the factoid here. Oh, yeah. So when he made it to the 1990 French Open final, this is what he was rocking. And it was so crazy at the time, they were thinking of going to Wimbledon rules where they only allow you to wear white. White. And yeah, this was kind of like that flagship sneaker that kind of almost pushed Nike to go and transition into, or not Nike, the French Open to transition into an all-white dress policy. So he didn't win it that year, unfortunately, but he definitely looked OD wearing these. Let's be honest. Yeah, I mean, the cool thing about these sneakers was, because obviously they're a bit loud as far as color goes, and this kind of really fit Andre Agassi's persona as far as like, disregard for longstanding traditions, the bad boy persona, the wild colors, look at me, all that kind of ish, right? And it came with this cool kind of apparel, which I kind of wish I had, especially if I played tennis. I feel like I'd get this similar patterned thing. I think they recently retroed a Nike AirTech Challenge 2 with this kind of like vertical hot lava blocks colorway type of thing. I don't know. You'd have to see the picture to know what I'm talking about. But anyway, moving right ahead. Oh, the other thing I've mentioned about this multiple times is the sole for these shoes you may find familiar. They're actually what inspired / are used on Nike, Jesus Christ, Kanye West Nike Air Yeezy 2 shoes. So the Solar Reds, the Pure Platinums and the Red Octobers all feature that same sole. So, hey, yo.
Wait, are you on YouTube or Instagram?
I'm on YouTube. Why?
Oh, I just want to pull up the live.
Oh, there's no live. I'll tell you when there's the live.
All right, then.
Oh, Jesus. Do you remember me wearing these at Porch Fest?
Yeah.
All right, I bet.
Yeah.
So they definitely pop.
I like these a lot.
Oh, wow. Even George W. Bush. Wait, which one's the older one? W.
Yeah.
George H.W.
No, H.W.
All right, George H.W. Bush used to play tennis in these too, actually.
Yeah,
There's a picture of him online.
They do feel a little heavy for tennis shoes.
Yeah, but I mean, this
They're
was
cool looking,
1990 though, so
yeah, I don't know.
hey, yeah. So let's see, who else wore these?
These are probably these. I actually really like these.
Do you know who?
Wait, how much? Like, can you still buy these, or do you have to go like on a
those just came out.
They just came out.
Yeah, or no? I mean, this came out in 1990, but they just recently came back earlier this
But
year.
are they like a limited edition, or can like you?
Yeah, you can't just walk into Foot Locker and still get these. But they put out other colorways. They
like
probably
what, like $200?
I think it was 160.
Oh, that's not bad at all.
Yeah,
they're really cool.
Yeah. Who's the other guy that wore this? It was, do you know Dave Mustaine?
I really like this thing. Point it out.
Yeah, the hot lava.
Like is that what that's called? Yeah, like a lava lamp.
Do you know who Dave Mustaine is?
No.
He's the guy from Megadeth.
Oh, nice.
Yeah, so apparently he was rocking these. I don't really follow Megadeth, so hey,
You've never worn these, huh?
Not yet. I did wear the other pair. So for those that don't remember, we talked about this briefly on the podcast, but there was the older version from 2014 that I had. That's the one I wore to Porch Fest. But then these came out this year, and they're truer to that original form. So I was like, all right, let me get rid of the other ones. And that other kid bought it, so I sent it to him.
They are a little heavy, but I feel like this base would be like really good for grip.
Yeah, well,
Like just stopping.
Maybe. I'm not sure. I haven't put it to performance test. But
Yeah, but like just like feeling it.
yeah, I mean, it's got
Feels like you'd be able
a
to
very
stop on a
nice
dime.
herringbone traction for sure. And I think that's all I had to say really on the sneaker. Let me just double check here. Yeah,
So wait, you just got these like recently?
actually, I stand corrected. They retailed for $130. They came out May 28th. That's when I got them. Yeah.
Where'd you get them from?
The Nike app, because otherwise they sold out in my size. Let's see. Mid-top tennis shoe, visible air unit on the heel, white leather upper, black, gray, and hot lava overlays. The LeBron 16 recently came out in a similar colorway, which I think like reignited the hype for these. It definitely worked on me. I got.
The Nike is a cool little touch too.
Yeah. Oh, fuck yeah.
The pink.
Or
is that orange or pink? I can't even.
It's hot lava.
Not everything's hot lava.
Dude, that's the color name.
That's the color name?
That's the color name.
Oh, I thought it was just the design.
And Andre
Hot
Agassi,
lava.
it's the name of the colorway, but it's also the name of the color shade, because Andre Agassi actually did an interview where he was kind of tight, where people were like, oh, is it solar red? Is it pink? Is it atomic pink?
Yeah, I thought it
He's
was
like,
pink.
it's hot lava, bitch.
That's fine. I thought hot lava was the design of this.
No. Well,
The lava
that's
lamp
that's
thing.
the other thing that attributes to hot lava, but the whole
Yeah,
theme of
but
the shoe is
the
hot
theme,
lava.
Yeah, but what color would this be?
But they call the color hot lava as
call
well.
the color hot
yeah.
lava.
At least that's what Agassi does, and I'm going to go with Agassi on this one. And I believe
That is a really cool.
yeah, and I believe he is Iranian. Is you tight?
I don't care at all.
Okay. Someone
Actually,
else told me.
I kind of like how I like the Nike a little more than the swoosh.
Yeah, you would.
Well,
actually.
it's cool. It's like
yeah.
like,
sometimes
we're
they use
Nike.
both. Sometimes they use
Oh,
both.
I mean, they do right here.
yeah. Well, sometimes even just together.
But the
Or even
Nike's
on
a
the
little
tongue. Isn't it
louder.
on the tongue? Doesn't it say Nike with the swoosh?
Yep.
See? There you go. Or right on the butt. Right on that Nike Air on the butt. You get that ish. Yeah, boy.
Yeah, but that's not the lava.
Yeah. Yeah, well, what's she going to do?
What are you gonna do?
Yeah,
Here we go.
What it is. Here we go. All right, so that's pretty much it to the history of this sneaker. There was an interview clip with Andre Agassi where he actually talks about being tight, with everyone called it everything but hot lava. But other than that, I think we hit all the major points for this sneaker. Yeah, so here, they even quote it in this article. For starters, no one could seem to get the color right. Agassi remembers the media constantly referring to his sneakers and gear as pink, which he's quick to correct. This is not pink. For the record, this is hot lava. So, hey, you heard it here, not first, but multiple times. So there's that. Watch yourself. And I think we just nailed it. Boom. So, yeah, there you go. That's the history of the Nike AirTech Challenge 2s. Kanye triggered, basically. Moving right along.
I'm just going to bang it.
Dope. Actually, yeah. So that was it for sneaker history. Thanks for participating in the Nike AirTech Challenge 2.
That was cool. Those
keep
are
it
really,
moving.
really beautiful sneakers.
Dope. All right, let's go to...
These are probably one of my favorites you've ever got.
Bet.
I really like this combination.
You're going to love this combination.
Dude,
Hey.
this is really cool.
Yeah, no, I dig it.
No,
It's definitely one of the more...
This is fucking
Yeah,
beautiful.
it's one of the more underrated sneakers in the collection for sure. I don't think it
Who
gets enough
underrates
love.
this?
A lot of people. You might get a kick out of this. So for this sneaker,
beautiful.
for the sneaker
Wait,
release,
hold on, one sec. You said I could buy these for like $160.
130.
I could still buy these.
Maybe not these unless you got lucky at like a Foot Locker or something. They may still be sitting there, but probably not. But actually, let me just double check the price on these on StockX. Let's see what you bad boys been doing with the resale.
Told
on
you that
these.
sneakerhead who knew you was talking to me the other day at the bar because I was wearing these shoes you got me.
Oh, word.
He was like, "Yo, those are like really rare shoes."
They actually go for just $135,
Dude.
on StockX. So they're not going for that much higher than retail right now.
For size 11.
Lucky, yeah, size 11. Well, with shipping, it'll be like an extra $13, but it is what it is.
Never mind.
With that said, let's move on right into the sneaker release segment. This is kind of interesting. I want to get your thoughts on this. So Nike, before they chose the word Nike for their brand name, which is the Greek god of victory, they actually used to be called Blue Ribbon Sports, BRS. And when they were trying to decide whether to go to Nike or some other name, the other names were Falcon, Swoosh, and Dimension 6. So that's these three colors.
Falcon would have been kind of cool.
So that's kind of, I can't imagine them with like a Falcon logo, let alone Dimension 66666. Drake trigger.
The Falcon one is cool, but I think my favorite is this the Shoe Dog Pack Swoosh.
Yeah, so the Shoe Dog pack. Shoe Dog is the name of Phil Knight's book. He was the Nike former founder, former CEO.
I know who Phil Knight is.
All right, bet. We got a Fortune 500. But yeah,
Like
so
Jeff Bezos is.
he named his book Shoe Dog, and that's part of the the Shoe Dog pack because he talks about how he wanted to really call it Dimension 6.
What is this app I'm looking at? So these are all the releases coming out.
Yeah, this is
Wow,
like
there's
the
some really
calendar.
cool ones. I do like that Falcon one a lot.
Yeah, well,
I
it's
think
coming out.
I think the swoosh is really cool.
Yeah, but I don't think any of them are going to sell very well, but that's just me.
Well, the swoosh is only $120.
Yeah, that just proves.
But it's going to stand out because people are like, is that Nike or not?
All right, well, Fila triggered.
I mean, dude, I was on Fila and Champion like last year.
Moving on.
Actually, I like this one a lot too, the Royal Pulse.
Which one?
This one?
Let me see. The Air Max
It's a little
200
loud,
Royal
but-
Pulse. It's not for me. I feel like it's way more of a women-friendly shape, but that's just me. I don't know. In the
It kind
purple
of feels
haze
like
color.
like the Yeezy one, the dad shoe that came out.
Kind of. Yeah, I mean, that's kind of the trend right now. But yeah, Royal Pulse Air Max 200. Interesting.
Actually, go back to the swoosh one. I just want to look at it again.
Swoosh, the Shoe Dog pack. Yeah, it just looks like your typical Cortez, but with like a spoiler and and just a thinner swoosh. So hey, if it floats your boat,
Oh, it's
by
got
all
that nice
means.
blue on the bottom too.
Yeah, I mean they do a good job with color blocking usually. That's
Damn, dude. So you don't like this?
I like it, but I have essentially that exact shoe, the Nike Cortez. That's the shoe that was featured in Forrest Gump.
I can't picture it.
Yeah, but
Let me look that one up.
it basically looks the exact same.
It's called the. Wait, but this
I'll
is
give you the
Cortez
name.
too.
Classic Cortez 72.
My mic.
Just do Shoe Dog Pack Cortez. It'll pop up. Oh Jesus!
There we go. I got it.
Bet.
Shoe,
But yeah, I mean,
shoe pack dog. Cortez.
Shoe Dog Pack
Shoe dog pack.
Cortez. Yeah, I mean, nothing else has really caught my eye recently, which is kind of good. I'm getting a little sick and tired of buying new sneakers all the time. I need a break.
Oh no.
But yeah,
Oh, wait.
thank God nothing like super
This?
ODs coming out anytime soon. Yep. That's what I have that shoe, the Nike Cortez, the OG.
Oh,
Nike
that's
Cortez.
really cool too.
But
Let me see the other one.
This is the just a different swoosh, and it has the spoiler in the back.
Wait, what do you mean the spoiler?
Like you see the little spoiler, little heel tab piece.
Oh.
Yeah, that one doesn't have that.
I like that one more.
All right, well, it's probably going to
the
be
spoiler,
fairly available.
I had what are those Adidas ones? That's the first sneaker that you got me to buy. Those Adidas with the they got the little thing on the back.
I don't remember getting you to buy
got
Adidas.
the red, white, and blue on the back. They're the first shoe. Jesus, dude.
The NMDs. Yeah, the XR ones. Yeah. NMD XR1
Is that
and the
the same
OG
kind of thing?
colorway. Kind of, not really. But I'll show you after this. But yeah,
What's the difference?
I'll show you.
Oh.
That's pretty much it for sneaker segment. Let's roll that into the Lakers. I want to talk Lakers real quick. So last I brought this up, the Lakers had just gotten
Is like what fucking.
the Lakers had just gotten what do you call it? AD and Danny Green from the Toronto Raptors and Rajon Rondo and LeBron James and who's the other big pickup they got? They got
Melo.
Kuzma. Kuzma's still there.
Melo still in the league?
And nope. And fuck, they got one more person. Who the fuck did they get? Oh, Boogie Cousins and JaVale McGee, all on the Lakers. So they're going to be a bunch of big boys.
Haven't they had JaVale?
They did have JaVale. Yeah. So they got JaVale. Now they got Boogie Cousins and AD. That's a bigly ass lineup in the backcourt. In the front court. Oh, you forgot about the backcourt. Starting point guard LeBron James, who stands at 6'8", 6'9", and then Kyle Kuzma, which ain't a tiny dude either, but he is fairly slender. But he just needs to shoot them threes with Danny Green triggered. So
this is going to be such a good NBA season.
The Clippers
are
going to be scary.
Although I feel like next year it'll be a little better because Clay will be back and Durant.
Oh yeah, the talent level will be much increased. But I'm just saying it's wide open right now.
It's wide open.
And the two centers I think are in LA. Clippers and Lakers. I'm telling you.
Who do you think?
Think about this.
Who do you think wins it this year?
I don't know.
If you had to put like $50,
I'd do Lakers just because I have to.
Yeah, but if the
I'm
Lakers were in the league, who would you put $50?
Yeah, Clippers for sure. They got Paul George, Kawhi,
Paul George sucks,
Patrick Beverly. Well, Paul George sucks as a first option, but he
sucks as like a third option.
He's gonna
have Houston.
They lost almost all their guys.
Yeah, they still have Harden and Westbrook. How do you think
Harden and Westbrook is going to be fun?
How do you think that's going to go?
I think it's going to be fun to watch. I don't think they're going to win jack shit, but it's going to be fun. It's going to be like...
Well, they're both like... They both need the ball.
It's going to be last year's
they both need the ball.
Brooklyn Nets. So, like, the Brooklyn Nets were fun to watch, but they didn't do diddly squawk. You know?
Yeah. I really think it go either way. Because they have experience with each other, which is good.
All right. So, I think it'll work out okay, but I don't think they're winning jack. That's all I'm saying.
Well, you mean the championship, or you don't think they'll even make
make a dent in the playoffs?
So
first round exit.
What are the odds you think they go?
First round exit for sure. If they make the playoffs, I wouldn't be surprised if they don't make the playoffs because
you don't think Houston's going to make the playoffs?
I don't think so. Let's look up the standings. So,
weren't they like a
Golden State was the 1 seed last year. I guarantee they fall to probably 4 or 5.
Over who?
Let's find out. So next we have Denver Nuggets. I think they'll return maybe as a 6. Portland Trailblazers, they'll return 7 or 8. They could squeeze in, honestly.
I think Denver is going to be a 2 or 3.
Okay, so I think as far as all these go, let me just go one to last. I think in an ideal world, and me being biased, Lakers with the 1 seed, Clippers with the 2 seed. Then we go, I'm going to say Denver with the 3 seed, Portland with the 4 seed. Don't ever count out San Antonio, although who the fuck do they got, really? Yeah, they still have some people. So I would give them, what am I at?
That was 4.
Lakers, Clippers, Denver, Portland.
Yep.
So 5th, I'm going to say, let's see, San Antonio was 7th last year. Let's go Sacramento 5th as like a fun team to watch that kind of got it together all in the right time. Don't sleep on the Pelicans, but they're young as fuck. So I'm going to go Spurs 6.
So weird New Orleans is in the West.
Yeah, Spurs 6.
So weird.
And New Orleans 7. And then who's going to squeeze in? Maybe Houston. How about that? Houston's going to barely squeeze in.
Let me look at them.
I mean, put it up on your phone. I really can't turn this. So
the weirdest thing too, I mean, sorry to interrupt, but The weirdest thing is the fact that New Orleans is in the West. The only other weird thing is the fact that the Cowboys are in the NFC East.
Okay. Yeah, true.
Isn't that really weird?
No, that
it always bugs me. Dude, it's Giants, Redskins, Washington,
Yeah, why
and then
wouldn't
the
you-
Dallas Cowboys.
Yeah, why
It's
wouldn't
like,
you
it doesn't
just
make
do
any
like
sense.
Buffalo? Actually, that'd be a fun segment, just like reorganize all the divisions.
Yeah, I think Buffalo. Well, Buffalo's the AFC, but like, yeah,
Well,
they
if you were
should
to,
reorg-
if you were to
yeah.
think about this, it would be New England, Buffalo, Jets, and Giants all in the same division.
Yeah, that would be great.
That'd be fun.
That'd be cool.
Yeah. Then you could do NFC South. We'll say Bucks, Dolphins. There's no Alabama team.
Tennessee,
Carolina,
Tennessee.
and Tennessee Titans. All right, yeah. So that's the NFC
Yeah, I
South.
hate how they do it. Yeah, like
Actually,
now.
I'm about to just pull up these NFL standings. All right, so we're going to separate this out into the Lakers talk first, and then this is now the NFL.
Oh, I just pulled up the
Yeah, I know.
All right,
we're going
you
to
do the NFL.
We're going to reorganize the NFL standings. So
NFL standings.
So AFC East: New England, Buffalo Bills, New York Jets, New York Giants. Then we go to the.
AFC North. I think it's pretty good.
All right, let's just call that the AFC East. We'll do AFC
Well,
North.
Yeah.
We'll keep Cleveland. We'll keep Cincinnati.
Baltimore and Pittsburgh. It makes sense. They're all right there.
Well, let me look at the other teams. Why not Indianapolis Colts?
They're a little west.
I would put the Colts in with
Well, the
Cleveland and Cincinnati because it's all like
Colts
Midwest.
used to be Baltimore.
True, but I don't give a shit about that.
But I'm saying I think the AFC North is pretty tight.
Actually, oh yeah, because then the NFC North is like its own thing. Why don't we do? Yeah, 'cause
AFC. Hold on. Let's talk about the AFC West. Kansas City, LA Chargers, Denver.
don't forget we pulled the Giants from the NFC
No, from
East
the NFC
to the
East, yeah.
AFC East. So don't forget about that.
Yeah,
So
but the AFC West, Kansas City, LA Chargers. AFC West makes sense for the Chargers.
wait, we're not done with AFC South though. So
Yeah, but we got it.
let's do Jacksonville Jags, Miami Dolphins, Tennessee Titans, and Carolina Panthers. That's it.
Yeah, I think that makes sense.
Okay.
Yep.
So now AFC North, we said
I
you
think
want to just keep it all the same?
I think
All
it
right,
makes
but-
sense.
So that leaves us with the AFC West, which I would definitely do Los Angeles Chargers, Las
Oakland.
Vegas Raiders. It doesn't matter. They're still
Yeah,
Oakland
but-
or Las
yeah,
Vegas.
but they're still west.
And then maybe I would throw in the San Francisco 49ers and the Seattle Seahawks. Ooh, but that leaves the Rams.
yeah.
So I would actually pull in the Rams. Just I'd rather have both teams in the same city be in the same
Pulling the Rams
division.
and what? Kick out Denver?
Let's kick out.
No, Kansas City. I'd probably kick out.
I'd kick out Kansas City. So yeah,
Denver, LA Chargers, Oakland, who's going to Las
so that means we'd have to pull Kansas
And-
City into the
We don't have
NFC.
to do anything.
Yeah, we do because we already put the Giants into the AFC.
Yeah, but now we
East.
got to figure out the others. So
Well, I'm just saying the only team that didn't make it out of the AFC divisions is the Kansas City Chiefs. Is that right? Everyone else is accounted for. Or no, we didn't talk about the Houston Texans
not yet.
or the Indianapolis Colts. Fuck.
I would put them in the NFC North.
Which ones? Oh, the Colts. So NFC. No, I mean the
Actually,
NFC
writing
North
this
looks
down,
pretty
'cause
solid.
I actually
Chicago,
like our-
Minnesota,
I
Green
know,
Bay,
I like-
Detroit.
I like our ideas. I just feel like I'm like losing it.
Well, NFC East, I
'Cause I'm
think
like, oh,
we'll
yeah,
lose
wait.
Dallas, and we'll keep Redskins and Eagles, but then we'll add in. Actually, this is perfect. Baltimore Ravens should be NFC East. Baltimore Ravens, yeah. So Baltimore
Against
Ravens,
Washington, yeah, that makes sense.
and then
So then we put
who did we
in
leave?
the AFC North.
So we still have Kansas City Chiefs to account for, and the Indianapolis Colts, and the Houston Texans. So those are the three teams left.
AFC North. Just take Chicago from the NFC North.
AFC North
Yeah. So if we put
instead of
if with the Ravens.
no, the
So move but you were just saying move the Ravens into the
yeah, but we already
NFC
have an
East.
AFC North. Our AFC North is
yeah, but if we move the Ravens from the AFC North, like you just said, and move in the NFC East,
so why don't we put the
in place
Colts
of Dallas.
with why don't we replace the Colts with the Ravens?
Actually, all right. Can you pull up like a WordPad and we'll write this down? Because I want to do this.
Oh, Jesus.
I'm like at this.
All right.
All right.
So
Pull up something. Let's write this down.
So let's start again
All
from
right,
the
all right.
top. We're going to start with the
AFC
AFC East. And keep all this content in, by the way.
AFC East. All right. New England.
We're keeping New England.
Keeping Buffalo.
Keeping Buffalo and the Jets.
Jets.
New
and
York
putting in
Jets.
the Giants.
And we're putting in the Giants. And who got displaced?
Well, no, that's
the
just
Dolphins.
the AFC East.
The Dolphins got displaced.
Oh, yeah.
So let's move to the AFC South.
No, let's just, because this is how it goes on my phone. Let's just do the
Well,
AFC
you can't scroll
North.
down to South?
AFC North now.
Whatever. I'm just putting in South on my notes
okay.
and adding in the Miami Dolphins.
We'll put in, okay.
Miami Dolphins. Now, let's go back up to what? AFC North?
Sure. AFC North. So it's
I
Baltimore.
mean, sure. It's, you're calling
No, I know. Okay. It's Baltimore.
North.
It's Baltimore, Pittsburgh, Cleveland, and Cincinnati.
Pittsburgh,
So we
Cleveland,
already said we want Baltimore out. So don't include Baltimore.
Cincinnati all
So
stay.
Pittsburgh, Cleveland, and Cincy.
And then we're adding in Indianapolis now?
And adding in Indy. Yeah.
Indy. All right. So that's our AFC North. AFC South?
AFC South is
We got the
right
Miami
now-
Dolphins. Let's add in the Tampa Bay Bucks. Or actually, no. Let's leave them in the NFC for now. Miami Dolphins, Jacksonville Jags.
Mm-hmm.
Who's left? Houston and Carolina?
Tennessee. But yeah, we won't.
Oh,
put
let's do the
Carolina.
Titans.
Okay.
And then that leaves us with AFC South, Titans, Jags. So Texans. So maybe we'll just leave the Titans or the Texans and just pick up the Dolphins. So Texans, Titans, Jacksonville, and Dolphins. Fair?
Texans.
So the only team that got replaced,
I feel like
the only team that got replaced in the AFC South was Indianapolis Colts in exchange for the Dolphins.
sure.
Which is fine. So now we're at AFC West. So AFC West, we're going to keep basically everybody except the Chiefs. So Chargers, Broncos, Raiders. Chargers, Broncos.
I feel like we should honestly be doing this by like geography and then figuring out AFC, NFC. So we should just be doing.
Yeah, so we'll do that as we cycle back because we just did AFC purely. Let's do the
Yeah, but
NFC.
it doesn't matter. We should just do East, North, South, West for both AFC, NFC. Put all the teams in one and then separate them.
I don't think so because we're going to have two sets of East, like Giants.
I know, but like,
Bills.
but like for our argument right now.
But right now we're reorganizing based on geography anyway.
Yeah, but we're also
Within
reorganizing
divisions,
based on.
within conferences. But I'm saying it'll be
Conferences,
easier to nitpick conferences after.
Yeah, but let's just put them all. So like let's go
Well,
back.
it's too late because we already did the AFC. So
not
let's just
too
finish.
late.
Trust me. It'll be a quick fix later than now, which is ironic, I know. But anyway, so NFC East, we got rid of the Cowboys. We're doing the Eagles, the Redskins, the Giants. Eagles, Redskins, Giants, and we're gonna pick up somebody. So let's pick up the
Baltimore.
Well, Baltimore we left on AFC East, right?
I thought we got rid of them.
Did we do AFC East? I don't even think we got to. Or no, we did. Yeah. So we did Buffalo, New England, Jets, and Giants. Huh. So where did the?
That's what I'm saying. We should just do East.
We just never
We should just
did.
hold on. We should do East, North, South, and West. Not worry about AFC, NFC, and then separate them.
So okay. How about this? We just disregarded. Which team did I leave with 3? I'm looking at my sheet here.
Probably, I thought we said before.
1, 2,
we
3,
want
4.
AFC
1,
East
2,
to
3,
include
4.
Baltimore.
The AFC East.
Yeah, because they're
Instead of who?
Miami.
Yeah,
Oh, we
AFC
put
East is off Miami.
Giants there.
No, we put Giants there. I see.
Yeah.
So I'd rather leave the Giants there and the NFC. Yeah, so then the NFC East will pick
This
up.
is way too complex. We should really just do it by
No, this is
region,
actually perfect.
And then AFC,
Baltimore,
NFC. Okay.
Redskins, and Eagles all take the NFC East. We kicked out the Giants, but we still got to pick up somebody. You know, so that leaves. We could do Detroit, technically. Although, would Atlanta be closer? Is Atlanta more south or north? Why don't we do this? I'm going to put a little asterisk next
What,
to
Carolina.
Possibly. So I'm going to put an asterisk next to what team
Carolina's
was it?
closer to
What team are we reconsidering here?
Carolina.
No, not Carolina. NFC East. We kicked out. The Giants, right?
Yeah.
But we already reassigned the Giants, so the Giants are good. So let's just keep it moving. We'll come back. So the Kansas City Chiefs I have to replace still. But let's move on to the NFC South. So, or which one's next on your thing?
NFC North.
NFC North. So NFC North was pretty solid. We got Wisconsin, Chicago, Detroit, and who's the last one?
Green Bay.
No, we already said that. Wisconsin. Minnesota. Minnesota. All right. Don't you know Minnesota? So that's all said. Nice. That's pretty thanks for that. NFC South. NFC South. So
Atlanta, Carolina, Tampa Bay.
Atlanta, Carolina,
NFC
TB.
makes a lot of sense.
But we replaced Tampa Bay in the AFC South, didn't we? So
I think, right? What's your notes?
Dolphins, Jacksonville Jags, Titans,
we'll put the Dolphins in.
and Texans. So why don't we
We're switching
replace
Tampa Bay with the Dolphins? Just being
Tampa
assholes.
Bay? No. We'll leave the Dolphins. We'll leave Jacksonville, and we'll leave the Bucks. But the Bucks will take whose place? The Titans or the Texans? I'm thinking Titans, and then maybe we move the Titans to AFC or NFC East.
Yeah, because they are a different time zone.
So we'll do, what is it? The Bucks. So Bucks will go to AFC South, and then Carolina, and or no, we're doing NFC South.
Yeah, NFC South. New Orleans, Atlanta, Carolina, Tampa Bay. We're switching out Tampa Bay for what, Miami, you said?
No. I was thinking AFC North switch up. So I was going to put the Bucks in. Actually, yeah. Hold on. Bucks, Atlanta, and New Orleans. Yeah. So we're going to take out the Bucks and put them in instead with, how about Houston? Yeah, Houston. But Houston is Houston Texans, and the Bucks go to the AFC South. Perfect. Okay. Perfect. AFC.
Perfect.
Bucks. No, Bucks stay here. Texans go there, and Jacksonville stays. Who are we missing?
Well, we have the NFC West still.
Texans. What the fuck? No, we moved the Texans.
That's why I said we should.
So bad. New Orleans, Carolina Panthers. New Orleans, Atlanta. We put the Houston Texans here in exchange for the Bucks. So that puts the Bucks here. But that's still, so we lose the Texans. But then who else made it to the AFC South? AFC South. The Colts. Where did we put the Colts?
I thought in the East. No, we leave.
Put
I don't
the
fucking know.
We put the Colts in the AFC
I told you to put up something.
North, which means we replaced
Baltimore.
Yeah, I guess Baltimore's got to go into the. Yeah, we fucked up. No, NFC East is Baltimore, which makes a lot of sense, actually. We're just missing. Yeah, this is not the right way to organize it. Let's just skip ahead to the NFC West. So the NFC West definitely should still have the Niners. See, this would be nice if the Raiders stayed in Oakland, because then we would do Raiders, Niners, Seahawks, and this is tough because you got the Rams in LA, the Chargers in LA, and the Cardinals, and they need a fourth. So maybe you do. This has been the sports segment. Thank you. Let's keep moving.
Yeah, all right.